Hi, my name is David Villar. I'm a professor of pharmacology and toxicology at the University of Antioquia in Colombia. Welcome to this video on general principles of anesthesia. This presentation will be very basic to understand what happens to an animal from a physiological standpoint when it's under anesthesia. So if you're already familiar with doing anesthesia, it won't really say anything new. On future videos, we will address in more detail the pharmacology of the different anesthetics and give some examples of protocols that can be used depending on the condition of your patient. So if we start by the definition of anesthesia, the word traces back to the Greek, which is a combination of without and sensation. In other words, there is a general loss of all the senses of feelings such as pain, heat, cold, touch, which is obviously going to allow doing surgery and other painful procedures. The typical anesthetic that we all tend to think of is a general one that renders the patient unconscious by acting on the brain, which is, as you all know, the central computer that controls all the body functions. In this situation, the individual is more than simply asleep because he's not only unaware of his surroundings, but he's also unable to move, feel any pain or any other sensations, and he will not remember anything that took place while being anesthetized. There are also two other types of anesthesia where we only affect certain areas of the body. With regional anesthesia, we block basically a cluster of nerves. An example would be doing an epidural injection in the lumbosacral backbone, and that basically numbs everything below the waist. This is often used in humans during childbirth. And if we talk about local anesthesia, it's only a small or a specific part of the body. This is obviously used for minor procedures, like when we go to a dentist to get a tooth extracted, or if we want to take a biopsy of the skin. In these situations, we use what are called local anesthetics, and maybe only affect one or several of those peripheral nerves that you can see branching out of the spinal cord to every organ and body part. I also wanted to include the term dissociative anesthesia to highlight a pharmacological concept that clinicians may not always be aware, because it's easy to relate anesthesia with a depressive state of the central nervous system. When we use drugs like ketamine alone, we create a state of dissociative anesthesia in which there is really more activity in different parts of the brain, but there is a dissociation or a functional disruption, if you like, between the different parts. In other words, different parts of the brain are not really talking to each other, and that produces a state of unconsciousness in the individual. However, as we will see in a minute, the body is in a state of catalepsia with a hyperexcitable brain, and in a condition like this one, there is usually a muscle rigidity. The individual is fixed or paralyzed, like you can see on this cartoon here. And this brings us to the next idea, that even though we can call any drug which creates unconsciousness as an anesthetic, it doesn't really necessarily imply that the animal is in a proper state to carry out a surgical procedure. It's going to be essential to abolish all pain sensations, create good muscle relaxation, and suppress most of those autonomic reflexes. So as you can see here, a state of balanced anesthesia requires not only a loss of consciousness, but also pain relief, which is what we call analgesia. The animal has to remain immobile with loss of muscle tension, and most, but not all, of the reflexes should be inhibited. I have highlighted in red that there is no anesthetic alone that meets all these properties, and for this reason and other ones, all the protocols that are used, you'll see that they have multiple combinations of different drugs, and the goal is to achieve this so-called state of balanced anesthesia. When we anesthetize an animal, not all parts of the brain are going to be affected equally at the same time. And in fact, the clinical response has always been divided arbitrarily into 4 different stages or levels that are used as the brain becomes progressively depressed with conventional anesthetics. And I have included here a figure to better understand these stages. Imagine that we did an electroencephalogram to measure the electrical activity in the brain. On both extremes, the animal would be, on the top one, would be convulsing or seizuring with the highest frequency of electrical impulses possible. And on the opposite extreme, we would have an animal with basically a flat or dead zero brain activity. And in between, we see that the frequency of the electrical waves is going to be higher when the animal is awake than when he's asleep or mentally resting. And in this figure, you can see the 4 classical stages of anesthesia. Ideally, we want the animal to proceed from a stage of being awake to a stage 3 of depressant or surgical anesthesia as quickly as possible. And ideally, we want it to do so without going through the initial 2 stages. That, as you can see here, the central nervous system is more active, and in fact, these are phases that are called voluntary and involuntary excitement. In stage 1, we could say that the animal is sensing that something strange is happening and is trying to react against it. So he may respond even in a violent way, basically struggling in an attempt to remain alert. Usually at the end of this stage, it will eventually lose consciousness and enter into a delirious stage of involuntary excitement. In this second phase, all the reflexes become increased. The animal will also react to any type of stimulator in a very exaggerated manner with uncoordinated muscle movements. So as you can imagine, these 2 hyperexcitable stages are not very desirable and should be minimized or avoided as much as possible. And if we look at the figure, stage 2 is also called cataleptic anesthesia. And as I mentioned earlier, ketamine is an anesthetic that when used alone will move the animal from the state of being awake to this second stage. And if you notice, this stage is pretty close to the one in which the animal enters into seizures. And in fact, many cats, when given ketamine alone, will seizure. So even if the animal is unconscious, it will be very difficult and even dangerous to conduct any procedure in this condition. The cat or dog will not be relaxed. He will be jerking and have muscle twitches all the time. And as I say, he could also go into a seizure in any time. In clinical practice, these 2 excitatory stages are grouped in what's called the induction phase. And part of the goals of a good anesthesia are going to make these transitional phases to go as smooth and quickly as possible. In fact, if we can manage to advance the animal from stage 1 to 3, skipping stage 2 altogether, that would be ideal. And in practice, this is done using very fast-acting anesthetics like thiopental or propofol, also known as the Michael Jackson drug, which are basically used to induce anesthesia. In stage 3 of surgical anesthesia, we could say that most of the cortex functions are now suppressed, but the respiratory and cardiovascular centers, which are located in the brainstem, remain unaffected. So ideally, the animal is now having a regular and stable breathing and heart rate, and as long as these are capable of maintaining a good perfusion to all the organs and oxygenation to the tissues, the animal is going to be fine. As I will mention in a minute, most of the complications of anesthesia will come from the cardiovascular and respiratory not doing their job. And if we give an overdose of an anesthetic to an animal, he will move from stage 2 to stage 4, in which these medullary centers that control respiration and cardiovascular function basically stop. And unless we can artificially support these functions, the animal is obviously going to die. Now, if we look at this other table that groups anesthetics according to the stages, we can see that ketamine, which is a fancy cyclidine, will simply achieve a stage 2 of anesthesia, which is a state of hyperexcitation with a very high risk of the animal going into seizures. By contrast, if we look at some of the barbiturates like thiopental, it will move the animal very quickly from stage 1 to stage 3, skipping phase 1. And obviously, if you overdose, it can create a stage 4 of medullary paralysis that can kill the animal very quickly. Now, anesthesia always carries a risk to the life of the animal, so we have to at least mention what are the most common complications that can happen during the anesthetic procedure and that can threaten the life of our patient. The most frequent one is by far hypertension. This is one reason why animals may die during the recovery phase when we take all the support systems away from them. So if we can monitor blood pressure throughout the surgical procedure, it's always a good indicator that tissue perfusion is not being compromised. I won't really go into much detail here, but if you wonder what are what is considered by hypertension for a dog, it would be a systolic blood pressure of less than 80 millimeters of mercury. For a non-anesthetized animal, the normal value is between 160 and 160 millimeters of mercury. And this is usually measured with a Doppler detector that are available and is a non-invasive method. I will not say much about these other complications here because this would really be a topic for an even longer presentation. As you can see, there are other three hypo situations. We have hypoventilation, hypothermia, hypoalgesia, and bradycardia. I'll have to say that in spite of all the safeguards that we can put in place to reduce the risk of any of them happening, they are somehow unpredictable. So we should always pay close attention so they can be corrected quickly because, as I say, they can be dangerous and potentially lethal. To wrap up this presentation, when a protocol of anesthesia is designed, there are always similar steps that the animal will go through regardless of which drugs are chosen. There are probably hundreds of different combinations of drugs that can be used, but in all cases they follow the sequence that you see here. The first part of any protocol, after you have completed all the preliminary tests and examinations on the animal, is to prepare the animal in what's usually called the pre-medication or pre-anesthetic stage. And basically the goals of this stage are to reduce the general anesthetic that will be required and consequently the risk or complications that are associated, which I mentioned earlier. Another goal of this phase is to make the induction phase as smooth and quick as possible, avoiding all those unwanted reflexes and behaviors of this induction phase. In order to achieve these goals, the drugs that are most frequently used are a combination of a sedative or tranquilizer and an analgesic, which is usually an opioid. And when these two categories of drugs are used together, we create a state of what's called neuroleptoanalgesia. The next phase is the induction phase, which is basically the transition from being awake to the anesthetized states. In other words, we're now injecting the anesthetic and provoking the loss of consciousness in the animal. The next one will be the maintenance phase. Basically, we want to maintain general anesthesia during all the surgical intervention. And finally, the recovery stage is, we can say, is the period that will take from the animal to regain all its normal functions, not only mental ones, but eating, drinking, bowel movements, and so on. Just to illustrate a couple of examples of anesthetic protocols, and you may want to pause to take a closer look at this slide here. But if you can see, they start with a pre-medication phase. In this case, they are choosing a combination of acepromazine as a sedative and oxymorphone, which is an opioid. They probably wait a few minutes, 20 or 30 minutes, and then they induce anesthesia with ketamine. On the lower protocol, they are using thiopental instead of ketamine as the induction agent. Then they maintain the anesthesia with isoflurane, which is a gas anesthetic. They are also providing an additional analgesia by applying a local anesthetic, which is bupivacaine. And so you can see here that they are combining general anesthesia with regional anesthesia in these two protocols. And finally, they are providing with an analgesic in the recovery phase for the treatment of postoperative pain. And they're using non-steroidal drugs, which is ketoprofen on the top one and meloxicam on the lower protocol. This is the final slide. I hope the information presented here was useful. As I say on future ones, we will cover the different types of drugs that are used in anesthesia and how we can use them in combination to tailor the needs of each particular patient that may need to be anesthetized. So again, thanks for listening, and I see you on future ones. Bye-bye.